This video provides training on how to use home mechanical ventilation. The training you are about to receive is specific to the Prisma Vent 40 and is therefore not transferable to other devices. Home mechanical ventilation provides a way of supporting breathing outside of the hospital setting. The intention of the treatment is to improve quality of life and relieve symptoms. Home mechanical ventilation is delivered by a machine attached to a hose and firm-fitting mask, or via a tube in the neck called a tracheostomy. The machine delivers a steady stream of air at a pre-decided volume, pressure, or a combination of both. Usually, the machine provides two levels of ventilation. One is a low continuous pressure, felt at a slight resistance when breathing out to keep the lungs open for longer. The other is a higher pressure, felt when breathing in to assist with providing a bigger breath. The machine is set with a backup rate, so if it detects a pause in the person's breathing, it will deliver a breath for them. This is to ensure a consistent breathing pattern throughout the night. Some medical conditions that relate to the lungs, nerves, and muscles can lead to a problem with pulling air into and out of the lungs. Breathing feels harder work and muscles become tired. This can lead to a buildup of carbon dioxide in the blood and a reduction of oxygen, especially at night. Home mechanical ventilation may enable breathing to be more effective, so muscles have time to rest. It also helps to keep the oxygen and carbon dioxide levels within normal limits, as high levels of carbon dioxide in the blood can be dangerous and lead to hospital admission. Signs and symptoms of raised carbon dioxide include lack of quality sleep, morning headaches, pins and needles in the fingers and hands, daytime sleepiness, lack of concentration or alertness, shortness of breath, and tremor of the arm, known as a CO2 flap. Connect the power cord into the back of the device and into an AC power outlet. Additional oxygen can be delivered through an oxygen port. If oxygen is required, the home NIV team will advise you further. A black air inlet filter prevents any dust or debris entering the device as it is drawn in, and this should be checked once a week and washed in warm water before being left to air dry and put back into place. This filter should be replaced every 6 months. A white pollen filter may also be in use behind the black air inlet filter. On the right of the device is a compartment containing an SD card. Data can be downloaded to ensure the correct settings are applied or troubleshoot any problems. You may be asked to remove the SD card and replace it with another by the home ventilation team. The ventilator will still work normally and provide therapy whether the SD card is present or not. However, no data will be recorded if one is not present. A modem can be attached to the left of the device, allowing the home NIV team to review and make changes remotely. An internal battery is fitted in the device. The number of usage hours varies and will depend on your settings, the age and health of the battery, the ventilation settings, as well as ambient temperature. The battery will allow the ventilator to run in the event of a power cut, but also allows the ventilator to become portable. The amount of battery power remaining is represented on the screen by a battery icon. Each segment represents approximately 20% of available battery. The battery is charged automatically as soon as the device is connected to the power supply. The consecutively flashing segments of the battery indicator shows the charging process. Once the battery indicator is displaying 5 segments and is no longer flashing, the battery is fully charged. The air outlet is located on the front of the device. This is where air is delivered from the device to the mask. Attach the bacterial filter to the air outlet. It will only attach one way, so you can't get this wrong. This must be used with the device to protect from any bacteria. You will use a white filter for a dry circuit, or a yellow filter with a humidifier or wet circuit. Connect the hose firmly onto the filter and the free end firmly onto the mask. The mask shown in this video is the F20, and it is the most common mask we use, but it may differ to the mask provided. It has a cushion which allows a firm seal to be made. If the mask is dirty, it will not form an effective seal, and air will leak as it moves around. Please don't over-tighten the headgear, as this can lead to pressure areas, particularly on the bridge of the nose. Instead, please remove and reapply the mask to improve the fit. It is important to reduce leaks to ensure the machine is giving the right size breath. At the front of the mask, there is an exhalation port to allow carbon dioxide to escape, and you will feel the breath out here. Please ensure this is kept clean and not blocked or covered. You will be shown where this is, depending on the type of mask. Firmly but comfortably apply the mask. This should sit on the bridge of the nose and in the chin groove. You should be able to fit 2 fingers into the side of the straps, which ensures it is not too tight. Some individuals may choose to have the air flowing or the ventilator switched on before applying the mask. The power supply indicator on the front of the device should now be illuminated, confirming the device is connected to an AC power outlet. To turn the device on, press the on-off button briefly. There may be a delay before the device switches on into standby mode if it was completely shut down following its last use. Being in standby mode is indicated in the middle of the screen on the left-hand side with a fan icon with a line struck through it. This is the home screen of the device with the time also being displayed. If the device is running on battery, a medium priority amber message will display. The alarm acknowledgement button will also be illuminated. The device should always be connected to mains power supply unless necessary to ensure therapy is not interrupted due to a loss of battery power. Press the alarm acknowledgement button once connected to mains power supply to clear the message. By pressing the prescription key in the top left-hand corner of the device, you will be able to review the details of the ventilator settings if needed. Once confirmed, press the home button to return to the previous screen. The Prisma Vent 40 device enables some patients to have more than one prescription. By pressing the program key on the top left-hand corner of the device, you can select which preset prescription you require. The device can hold up to 3 numbered prescriptions, and the number available will be highlighted in bold. Having checked which prescription you require, use the dial on the device to select the prescription. Press the middle of the dial, then press the home key, which will take you back to the home screen. The settings are locked and cannot be accidentally changed. The system button allows you to view the options menu, where you can adjust the alarm volume, date, time, and screen brightness to suit your needs. You may be asked to access the alarm log to help the team resolve any issues with the ventilator. To do so, press the report button and press the control dial to display the list of stored alarm messages. To start treatment, ensure the correct prescription has been selected if more than one program is available. Press the on-off button briefly to start ventilation. The screen will now display device settings, ventilation parameters, and the mode of ventilation on the left-hand side of the screen. On the right will be the details relating to pressure and leak, represented by a moving green bar. You can change the information shared on the screen, depending on your preference, by pressing the monitor key. To reduce sleep disturbance from the screen brightness, the control dial can be pressed to activate a screensaver which will display ventilation mode and if a satisfactory mask seal is present. If an alarm sounds, the device will return to the previously selected viewing display. To stop treatment, press the power button and wait for the orange bar to load, which will set the device into standby mode. Once back on the home screen, press and hold the on-off power button to shut the device down once the orange bar has fully loaded. The machine may alarm to tell you that there is a problem. If so, a box detailing the reason for the alarm will appear on the screen. This will flash red, yellow, or green depending on the seriousness of the alarm. If this occurs and you are caring for someone, check that they are okay. The alarm will continue to sound until the issue is resolved. The alarm message displayed on screen may offer an immediate solution. Once the issue has been fixed, the alarm will automatically stop and clear the notification. If you are unable to fix the issue, please contact the Home NIV team and we will advise you on what to do next. A humidifier may be added to the device. This enables air to be passed through a warmed water chamber, helping to add moisture and reduce dryness and improve comfort. To attach the humidifier for the first time, Remove the side panel of the ventilator by pressing the button on the left-hand side under the handle. To fill the water chamber, feel for the lower part of the humidifier at the back to detach the top of the humidifier from the water chamber. Fill the chamber with boiled, then chilled tap water to the max 400 ml line marked on the side of the chamber. The metal heating rod must always remain in place to enable the humidifier to work. Reattach the humidifier cover over the water chamber, placing the back on first, and then click the front into place. Carefully reinsert the humidifier unit back into the ventilator. Alternatively, the chamber can be filled laying the entire humidification unit on its side, filling to the maximum fill line through either of the inlet openings, then reattach to the ventilator, clicking it into place. The device must be connected to AC mains to run the humidifier. It will not operate on battery alone. If the message, "The attached power supply does not support humidification," is displayed, check that the device is connected to a mains power supply. To enable humidification to be delivered, the humidifier key on the left-hand side of the screen should not be illuminated. To switch off, simply press the button. Once therapy is commenced, a droplet symbol on the top left-hand side of the screen should turn green to indicate that humidification is being provided. To adjust the level of humidification, press and hold the humidification button. This will open the system menu, whereby the level of humidification can be altered between levels 1, which is the lowest, to 6, which is the highest. Press the dial to confirm, and then the home button to return to home monitoring screen. The level of humidification suitable depends on room temperature and humidity. If you have dry airways in the morning, the degree of humidification is set too low. If condensation has formed in the circuit in the morning, then the level is set too high. White filters on the air outlet should be changed weekly. Yellow filters used with humidification should be changed daily to prevent being blocked by moisture. If you require any additional consumables, such as a hose, filters, or mask, please contact the Home NIV team on the contact details below. The hose should be washed weekly in mild detergent, rinsed in clean water and left to drip dry over a shower rail or door. Never use bleach to clean the equipment. Replace the water in the humidifier chamber daily and wash once a week. Take care that the heating rod has cooled down sufficiently before touching. The lower part of the humidifier chamber and black insert can be washed in a dishwasher on the top shelf or using hot water and mild detergent. However, the white outer upper casing and metal heating rod is not dishwasher safe and should only be wiped with water and mild detergent. Advice regarding descaling is available from the Home NIV team. Don't ever use any harsh chemicals. Wipe the inside of the mask with a damp cloth daily. Do not use baby wipes, as this can damage the seal. Cleaning the mask daily will help to achieve a good seal and prevent the mask moving around. Wash the headgear in warm, soapy water and leave to dry naturally. Thank you for watching this video on how to use the Prisma Vent 40.